Hello, I'm Dr. Fred Venditti. I'm the Hospital System General Director here at Albany Medical Center Hospital. I'm here with Dr. Dennis McKenna, who today starts as the new President and CEO of Albany Medical Center. I'm absolutely delighted to introduce him.
Thank you, Fred. I appreciate that. I'm humbled, and I'm so proud to work for this incredible organization and people such as yourself. And I think I'll tell you a little story at the end about my first moments on the job.
Terrific.
Okay. Thank you. So today is Incident Command Day 24, and we normally talk about the numbers in Albany County. Today I'd like to talk about numbers in the region of patients who have tested positive for COVID-19. Albany County, 226, Schenectady, 85, Rensselaer, 55, Columbia, 41, and Saratoga, 85. So you take those 5 counties, it's 492 patients who have tested positive for COVID-19. We mention that because we often talk about Albany County, but we service a whole region of patients who come here, and it's important to provide context. It's still also important that we do social distancing. We think that strategy is definitely working, and we encourage you to continue to do that.
Yes.
So we thank you for that. Let's talk about the numbers inside here in the medical center. This morning we have 39 patients in the hospital who have tested positive for COVID-19. We have 26 of them on floor beds, and we have 13 of them in ICU beds, and of those, 5 are ventilated. Now you may recall yesterday we had 25 in the hospital who were positive, so that number has gone up. We had 4 patients who were admitted yesterday from the region, so the number of people that came in who weren't from the region increased. And you perhaps have heard that we took some transfers from downstate. So Fred, what happened?
So yesterday, Dennis and I received a call from a CEO down in Queens, the CEO of a 2-hospital system, Jamaica Hospital and Flushing Hospital. And he described for us a situation down there where they needed some help in terms of care of some of the patients they had in their emergency department. So we agreed, as we would agree to any transfer of patients into our system, we agreed to take those patients. We organized the logistics, and in the evening into the nighttime hours yesterday, we actually received 14 transfers from them, some on our med-surg unit and some in our intensive care.
So the context here is really quite important. We were contacted late last week by hospital associations in New York State who wanted to know, as a regional tertiary care medical center that takes 16,000 transfers a year, what role we might be able to play if a request came to take transfers from anywhere in the state. We described our process, and we said at that time, if called, we're happy to help. So that call came yesterday. And as we had promised to the hospital associations, we would follow our same protocol. And the reason we take those transfers is, number one, that is our mission. That has always been our mission, and we're always happy to do that, and we know that we can provide the care that's needed. The other thing we reminded the hospital associations is, if there's a patient in an emergency department and they call us and we have capacity, we actually have an obligation under federal law to take that patient. We consider that piece to be important, although the mission is really the reason we take those patients.
That's right.
So we did. And Fred, they got great care.
They absolutely received great care. I'm very proud of the staff on C2, the unit that the med-surg patients went to, and our MICU and D3 North staff. They've done a tremendous job. And I can say that the patients are grateful for a place to be cared for. They've said that to us.
So Fred, a question that might be asked is, okay, we took those patients from a part that's not around our region. Are we still able to care for people in our community?
Dennis, we absolutely are. This is something that we're very cognizant of, that we have a responsibility to our region, and we're not going to do anything to jeopardize the care of patients in our region. The fact that we took those patients yesterday really doesn't affect our status at all. We're in status 1, or tier 1, for the med-surg portion of the institution, and we're in tier 2 for the critical care portion of the institution. And that tier 2 critical care status is really in anticipation of what perhaps is starting to come at us. We are converting some of our beds to negative pressure rooms in anticipation of more patients.
So I hear tier 1, I hear tier 2. We can go all the way up to tier 5.
That's
so we
correct.
Still have a significant growth.
We do.
So how do we model that? You and I are both people who have an interest in numbers. We're both local people, we're both doctors, but we also love numbers, and we love to model numbers. And I think you've been playing around with some statistics and some algorithms that can project that out.
That's right. Over the weekend, we started working with our analytics team. We have a great analytics team. We gave them a whole bunch of variables about the population and our capacity, et cetera. And they've actually built a model for us so that we can see how this surge will affect us, what the growth will be, and we can determine, frankly, when it's safe for us to take patients from outside the region and when perhaps we need to slow that down or even stop it so we maintain capacity for the growth of patients coming out of the region. So we're going to spend a little time this afternoon looking at that.
And when you model that, you're modeling rooms, you're modeling staff, and you're also modeling PPE.
PPE, staff, rooms, ventilators, all the critical elements that are necessary to care for patients. And on the PPE front, Dennis, I can tell you and everyone watching that we have very adequate supplies. We've been being very careful in how we use them. The supply group has done a tremendous job getting more of these supplies for us, the supply chain folks. We're in a good place there as well.
So we understand our sacred mission to care for this region. We'll continue to do that, and we'll do that
Absolutely.
safely. Very good. Do you have any questions for me?
You know, Dennis, I do, and this is a question that actually just came in from someone outside the organization. How do we know that AMC is still safe now that they've taken COVID-positive patients from New York City?
Okay, very good question. Well, the answer is we were safe yesterday and we're safe today. It's nothing different. So if those patients come in by ambulance from the city of Albany, if they come in from the region, or if they come in from upstate or downstate, they're cared for in a safe manner. We protect the patients, we protect our staff, we monitor our staff, we have all the safeguards in place that we've always had, and the actual number of patients in the hospital should not change that equation because we always do the same things every time.
That's
so
right.
I would say we are as safe as we were yesterday, and I think we'll be as safe tomorrow as we are today. But we'll watch it very carefully.
I agree.
Okay, good. Thank you.
Thanks.
I'm going to leave you with a story I told a couple people this morning. So as Fred mentioned, today is my first day in the role as President and CEO. And we were both here last night. We wanted to be here when the transfers came from downstate. We take transfers all the time, but this one was a little bit different, and I think we felt it was important to be there. I came in later in the evening, and the first transfer started to come in around 9, 10 o'clock. And my official first day in the job is at midnight today. So I was in the hospital right at the stroke of midnight. And I happened to be in our critical care unit, and I saw a patient that had been transferred from downstate getting the greatest care that that patient could receive by our incredible doctors and nurses and respiratory therapists. And I said to myself, if this is how I spend my first minute on the job, then I've landed the best job I could have, because I was so proud of the team. It was incredible. So anyway, just wanted to share that story with you. We ask you to please take care of yourself, take care of each other. Thank you very much, and we'll see you tomorrow.